We are back. Now I'll be talking about the muscle anatomy of the lower body. So now I'll be talking about the rectus femoris. So the rectus femoris originates from the anterior inferior iliac spine and the exterior surface of the bony ridge which forms the groove on the iliac portion of the acetabulum. And it inserts into the patellar tendon as one of the four quadriceps muscles. So the action of the rectus femoris is that it helps in the extension of the knee and the flexion of the hip. I'll be talking about the vastus intermedius right here. And the vastus intermedius originates from the anterolateral femur and is inserted from the quadriceps tendon. So the action of the vastus intermedius is that it also helps in the extension of the knee joint. And now for the vastus lateralis. So it originates from the greater trochanter and the intertrochanteric line and the linea aspera of the femur, and it inserts by the patella and by the quadriceps tendon, and tibial tuberosity by the patellar ligament. So the action of this is that it helps in the extension of the knee and the stabilization of it. And now for the vastus medialis. It originates from the medial side of the femur and is inserted at the quadricep tendon. And so the action of this is it also helps in the extension of the knee. And now I'll be talking about the sartorius. So it originates from the anterior superior iliac spine of the pelvic bone and is inserted from the anteromedial surface of the proximal tibia in the pes anserinus, and the actions of it is that it helps in the flexion, abduction, and lateral rotation of the hip, and it also helps with the flexion of the knee. So now I'll be talking about the semimembranosus. So the origin of this is at the ischial tuberosity, and the insertion of this is at the medial condyle of the tibia. So the action of this is the extension of hip, palikod. Extension of hip, yan. Extension of hip and the flexion of knee, palikod, yan. Okay. And the next muscle that I'll be talking about is the semitendinosus, and so its origin is at the lower quadrangular part of the tuberosity, and the insertion is the at the pes anserinus. It's at the tibia, and so the action of this is same as the semimembranosus, is that it extends the hip joint, balik, balik, yeah, and it flexes the knee. There. So next, I'll be talking about the biceps femoris. So it originates from the tuberosity of the ischium and the linea aspera and the femur. It is inserted from the head of the fibula, which articulates the back of the lateral tibial condyle. So the actions of this is that it flexes the knee joint. So you need it flexes the knee joint, and it laterally rotates the knee joint. Yeah, laterally rotates the knee joint and extends the hip joint. There. And now for the adductor longus, so the adductor longus. The tendon of this muscle can be palpated as a cord-like structure that attaches to the bone, immediately inferior to the pubic tubercle. So it can be palpated here, the middle. So if you want to palpate it, you have to push the muscle inside. I push the thighs medially, and so this here. And for the adductor brevis, the adductor brevis is harder to palpate because it is directly under the longus and it is very sensitive. So it is under the longus. And so for the pectineus, it can be palpated above the longus and the brevis, and it is lateral from the pubic symphysis. So here's the pubic symphysis, and the pectineus is somewhere, somewhere here. So for the gracilis, it attaches from the tibia to the pubis area. So first you have to find the longus, and so find the longus, you have to adduct the and then it is medial from the longus, so a little bit lower, and you can feel it by uh, following the muscle from the tibia to the pubis. For the abductor magnus, before we can find the abductor magnus, we have to palpate a few different muscles. So first the hamstring, and above we have to find the gracilis, because the adductor magnus is between uh, the gracilis and the hamstring. So it is right here. And now for the tibialis anterior. So the tibialis anterior originates from the upper one half of the lateral condyle of the tibia and is inserted from the medial cuneiform and first metatarsal. And the action of this is that it dorsiflexes and helps in the inversion of the foot. So dorsiflexion and inversion, inversion, and then dorsiflexion. And now for the extensor hallucis longus. So it originates from the arisement from the middle portion of the fibula on the anterior surface and the interosseous membrane, and it is inserted at the dorsal side of the base of the distal phalanx of the big toe. So the action of it is that it extends the big toe and it assists in dorsiflexion. And now for the extensor digitorum longus. So this originates from the anterior lateral condyle of the tibia and the anterior shaft of the fibula and superior 3/4 of the interosseous membrane. So it is inserted at the dorsal surface, middle and distal phalanges of lateral 4 digits. And so the action of this is that it helps with the extension of the toes, and it helps dorsiflex the ankle. So now for the peroneus tertius, assuming that a person has it, so it originates from the distal anterior surface of the fibula and also the anterior membrane, and it is inserted from the dorsal surface of metatarsals 5. And so the action of the peroneus tertius is that it helps in the dorsiflexion and eversion of the foot. So the dorsiflexion and eversion of the foot. And now for the uh, peroneus longus. So it originates from the proximal part of the lateral surface of the shaft of the fibula and is inserted from uh, the first metatarsal and medial cuneiform. So the action of this peroneus longus is that it helps with the plantar flexion and eversion, and it also supports the arches of the foot. So it helps in the plantar flexion and eversion of the foot. And now for the peroneus brevis. So it originates from the lower two-thirds of the lateral fibula and is inserted at the fifth metatarsal. So its actions is that it helps the peroneus longus with the plantar flexion and the eversion. So plantar flexion and eversion. So now I'll be talking about the flexor digitorum longus. So it originates from the posterior surface of the body of the tibia, and it is inserted at the plantar surface base of the distal phalanges of four lesser toes. So the actions of this is that it flexes the four smaller digits. So now I'll be talking about the tibialis posterior. So it originates from the tibia and fibula, and it is inserted from the navicular and medial cuneiform. And so the actions of this is that it inverts and plantar flexes the foot and the ankle. And now I'll be talking about the flexor hallucis longus. And so the origin of this is at the fibula from the posterior aspect of the middle one third, and the insertion of this is at the plantar surface base of distal phalanx, and the action of this is that it flexes all joints of the big toe and it plantar flexes the ankle joints. So now I'll be talking about the soleus. So the origin of this is at the fibula and the medial border of the tibia. And so it is inserted at the tendocalcaneus, and the action of this is the plantar flexion. Next that I will be talking about is the gastrocnemius, and so the origin of this is at the uh, superior to the articular surface of the lateral condyle of the femur and medial condyle of the femur. So it is inserted at the tendocalcaneus or the Achilles tendon and into the mid-posterior calcaneus. So the actions of this is the flexion of the knee and the plantar flexion. There. So now I'll be talking about the foot and the ankle motion. So first is the plantar flexion. So the action of this is that it flexes the foot and downwards towards the sole. And the muscles involved here are the peroneus longus and peroneus brevis. It also involves the gastrocnemius, the soleus, the tibialis posterior, and the flexor digitorum longus and the flexor hallucis longus. And so next is the dorsiflexion. So dorsiflexion is an upward motion, and the muscles involved are the tibialis anterior, the extensor digitorum longus, the extensor hallucis longus, and the peroneus tertius if it is present. And next is the inversion. So it is a combination of adduction, supination, and plantar flexion. And the opposite of that is eversion, which is, which is a combination of abduction, pronation, and dorsiflexion. So inversion, eversion. And next is the abduction. So it is a movement of forefoot laterally. Movement of forefoot, forefoot laterally. And for the adduction, it is a movement of forefoot medially. So adduction, abduction. And next is the supination. So for the action of the supination, it is a inward rotation of the ankle and adduction of the hind of the foot and inversion of forefoot to the medial arc. So the muscles involved are the extensor hallucis longus, the tibialis anterior, the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. And next is the pronation. So its action is abduction, eversion, and dorsiflexion of the foot. And so the muscles involved here are the peroneus longus, peroneus brevis, and the peroneus tertius if present, and also the extensor digitorum longus. So now I'll be talking about the medial arc of the foot. And so it is at the medial part of the foot. And the muscles involved here are the abductor hallucis, the tibialis posterior, the peroneus longus, and the flexor hallucis longus. So now I'll be talking about the lateral arc of the foot. So it's the lateral part of the foot, and the muscles involved here are the peroneus brevis and the peroneus longus. Now I'll be talking about the transverse arc of the foot. And so the support primarily comes from the adductor hallucis, the peroneus longus, the tibialis posterior, and the interosseous muscles.